back, everybody, to the Weiner Wellness Virtual Summit, and we are here with Dr. Gideon Orbach from the Weiner Wellness Center, and he's going to be telling us about chiropractic, neurology, rehab, and home workstations, and this is part 2. So if you missed part 1, you got to go back and watch that, and then you can catch up right here. Well, hello, Dr. Orbach. How's it going at the Weiner Wellness Center today?
Hey, Tracy, it's going really well, thanks. How's it going in your household?
Well, you know, we got roosters and chickens running around as always, but it's good.
On purpose?
Yeah, right. Well, it's good to see you. I'm going to step back and let you get into your lecture because I'm sure there's people very excited to hear it.
Well, I'm very excited to tell it. All right. Hi, everybody. My name is Gideon Orbach. I feel like we've met before. I've been practicing chiropractic here at the Weiner Wellness Center for actually it started off as a pain release clinic when we were on the south side. Then we moved to this building here in Green Tree, where we're conveniently located so close to Highway 79 and Highway 376. So we're pretty easy to find. We got ample parking. We got a big building. We have laser beams on the roof saying you are here, you're in the right place. And at that time, we renamed the practice to the Weiner Wellness Center. As I'm sure everybody knows, Dr. Weiner passed in December of 2017. And since then, the combination of his estate and now Jamie Dorley have been doing an excellent job, have been masterfully running the business. And we're in the process of converting into WOW, the world of wellness. So it's all the same place, most of the same people, a few new faces, but most importantly, all the same philosophies and ideas and values that we hold, which is basically we want to do everything we can to help our clientele, and we want to treat people fairly. Now, as for me, as I think I mentioned, I've been here with this group for closing in on 14 years now, and August will mark my 20-year anniversary since my graduation from chiropractic school. So I've been at it for a while, hardly a lifetime, long enough to have noticed a few things, long enough to have learned a few things in practice, and hopefully I got some good stuff to share with you today. So what I do is I do chiropractic adjustments to the whole skeleton, to the spine, to the extremities. I mean, you hear about a lot of chiropractors that are associated with back pain because their practice is limited to, they've made the conscious decision to limit their practice to adjusting the spine. I adjusted somebody's toes this morning. I also work on muscles. I do a little bit of muscle release, deep pressure trigger point work, some range of motion trigger point work, and I do some assisted stretching where I'm going to help you to stretch further than you know that you could. So we do this to help our patients enjoy better flexibility, better ranges of motion, of course, better coordination, better athleticism. To a certain extent, it even helps organ function, and we'll get into why that's the case later on in this presentation. And we just generally want our people to feel more comfortable living in their bodies. So that's me in a nutshell. In pre-COVID times, this presentation, or all the presentations, were actually done live, face-to-face, and there were people in the crowd who would ask me questions and heckle me a little bit, if you can believe that. And sometimes I would even give it back to them. So in this COVID times, obviously we're not doing live presentations, but feel free to use the chat box. I have Phil here up with me, who's a technological wizard. Tracy's in the background, who's almost as technologically wizardry as Phil. Between the two of them and myself, we'll be able to make sure that we can accommodate and get to any questions or comments, or even a few moral outrages if anybody has them. So feel free to chime in at any time. So in order to really make a presentation about what is chiropractic, how does it work, why does it work, who can it benefit, what's it all about, how do we incorporate a little bit of rehab, especially low-tech exercise. And when I say low-tech exercise, that means we're going to use your body as the equipment, and we're going to have you do body weight exercises, body movement exercises, position and posture exercises, breathing exercises, some of which we're going to touch on here today, and do some show and feel demonstrations and hopefully some participation from the other side of the Zoom. But in order to do that, the first thing we have to do is establish some common ground, and that would be what does it mean to be healthy? what would be your definition of health? What does it mean to enjoy good health? And, this is the point where the crowd would start heckling me and give their answers, and I'd heckle them back, and we'd start to have a good interaction, a good playtime back and forth. So hopefully we'll have that on the screen. But here's my definition of health. In order to be healthy, you have to be able to recognize, interact with, adapt to, and overcome your environment, both internally and externally. So your internal environment is what? It's your brain and how your brain is communicating with every single cell of your body, whether it's your heart or your digestive tract, or telling your toenails to grow, or telling your liver to do some detoxification and some cleansing. Your brain is the master computer communicating with every single cell of your body internally. And through the nervous system, there are a number of different mechanisms by which that happen. And we're going to talk about some of them, and we're going to explain what we can do to affect those mechanisms in a good way. Your external environment. Well, right now, I take great pride in knowing that I'm a big part of your external environment if you're paying attention to me. What are you focused on? When you were driving most recently and somebody passed you on the right-hand lane because you were going too slow in the left-hand lane, and you were going 94 miles an hour in the left-hand lane and thought you were just maybe even a little too fast, but somebody passed you in the right going even faster. Were you aware of them, or did they catch you by surprise? That would be an example of how you're adapting to your external environment, how you're recognizing it, and negotiating your way through space. And there are a number of different neurological mechanisms that make all of that happen. All right, so far so good. I don't see any messages in the chat board, but I do want to take a break for a shameless plug for the Pro Reds mixed in water. When your throat starts turning dry from talking too much, it's very soothing. It also has tremendous nutritional value and lots of antioxidants. Go Reds.
Is Reds your favorite?
The question is Reds my favorite? Actually, greens are my favorite. Ooh. In terms of the nutritional value. All four color drinks are good. They all have tremendous value. And just in terms of being something different, I prefer the greens. And I don't actually like vegetables. I force myself to eat my vegetables. So when I have my greens, I'm like, bonus round. I'm going to get 15 servings of greens today. But the thing about me and the greens is there's something about the greens. I can't tell you what it is. No matter what cup I drink it out of, I always spill my greens a little bit down the top of my chest. So maybe I'm not negotiating my external environment as well as I could because I spill my greens, and I wore a tie that I like very much today because I knew that I was making a presentation. So there you go. All right, enough of that. Another very important word that we have to discuss to make sure that we're all establish some common ground, and we know that you guys know where I'm coming from, and it's an important frame of reference if you want to chime in with any conversation topics that we can throw out a thread to. But the word pain. The definition of pain is an individual, emotional, subjective response to noxious stimuli. So first of all, what's noxious stimuli? Noxious stimulus is stimulus. Stimuli is the plural, so we have lots of stimuluses or stimuli. Noxious means harmful. To call it individual means, look, what stimulates me and what stimulates Phil and what stimulates the next person are three different things. So if we line up 10 people and Phil, who's a fantastic martial artist, kicks each one of them in the foot, one of them is going to look at him and say, Phil, is that all you got? And another one is going to say, Phil, call 911. I have to go to the emergency room. I've never hurt this badly in my life. And everybody else is going to fall somewhere in between. They all got the same stimulus, but they all interpreted differently based on how their brain and their nervous system were interacting with and adapting to and overcoming, or not overcoming, as the case may be in some places, their external environment. So that being said, this is crazy. If this has ever happened to you, or this has ever happened to somebody that you know, or somebody you've had a conversation with, and they said, I went to the doctor and the doctor said my pain was all in my head. That sounds very dismissive It sounds like we're being condescending to patients and not taking them seriously and saying, your concerns are illegitimate, and I think that you're a little bit off your rocker, and that's why you're telling me that you're in pain. Let's get you back on your rocker, and this will all be fine. So there's a lot of condescension. There's some meanness in that statement, but there's also a lot of truth. So if your pain is all in your head, this is even crazier. Here's where this comes about. During Civil War times, soldiers who were severely injured had some anesthesia that came out of an alcohol bottle, and then they had legs amputated. And then once the leg had been amputated, these guys would say, I still feel pain in my leg, in a leg that's not even there. So thus begins the concept of phantom pain. The phantom pain is studied over the years, and what we learn is that it's not actually imaginary phantom pain, but it's very real, because the part of the brain that perceives pain in that particular leg is still there, even if the leg isn't, and something is causing that area of the brain to perceive unreasonable, unrealistic, intense pain. Everybody got that? So far, so good? All right, I don't see anything in the comment margin. Phil's nodding his head, so I'm going to have another sip, give you another shameless plug, and keep rolling with it. So that very condition of the intense, unreasonable, unrealistically harsh pain in a phantom limb, over the years, we have to name everything, so it has a name now. It's called reflex sympathetic dystrophy, RSD. It's also called Sudeck's atrophy. So occasionally we have patients come in with maybe they have all their limbs intact, but they come in and they say that they've been diagnosed with reflexive sympathetic dystrophy with RS. I have RSD in my fill in the blank, naming my body part. The reality is that RSD is in the brain. It's all in the head. So I got to ask you the question now, how would we treat that? What could we possibly do to treat pain that's all in the head? So pain comes from a number of different places, causing environmental stress that we're unable to adapt and overcome to. For example, a nutritional deficiency can cause systemic or localized pain. We have, I believe, 30 some odd speakers this week, most of whom are nutritionists, chemists, lifestyle coaches who dwell on nutrition. I'm not that guy. I want to make sure that we're talking about, we're spending our time devoted to talking about how the body and the brain are interacting with one another, what kind of tricks we can do to improve those communications, to suppress our pain, to increase our ability to live comfortably in our own bodies. I don't live in a nutritional world. I don't deny the intense significance of having good nutrition. I just leave it to the experts. But follow me on this logic. If one has intense pain caused by a nutritional deficiency, wouldn't it stand to reason, by correcting a nutritional deficiency and providing the right kind of nutrition into the body, that some of, maybe even all of that pain will start to maybe to disappear? Okay, what else can cause that kind of pain? Certainly stress. Certainly we can use environmental stress. I think that everybody who's been through 2020 should get a Nobel Prize in survival expertise. I don't live there either, so I don't want to go into too many intense details about that. But every single one of us has been under magnified stress due to events of the past year, maybe even almost year and a half at this point. Certainly, the increased stress. I mean, I've seen it in my practice. I've seen it in my patients every day, that people will tell me how much worse things have been than they could ever imagine or they've ever been in the past, due to what the environment has thrown into their lap due to world events. Certainly the concept of autosuggestion. We can talk ourselves into pain. We can talk ourselves and convince ourselves into pain and dysfunction. It's very real. Those issues need to be addressed. We might even have enough time at the end to talk about very highly specific strategies to do that. But in the meantime, those things need to be acknowledged. We have to make it very clear that issues like nutrition, issues like mental, emotional well-being are critically and essentially significant in order to promote a good diminished, pain-free living and lifestyle. And those are all topics that I leave to other experts, because I'm going to continue talking about what we can do with our bodies to help diminish pain. So we want to do this. We want to think about brain-body communication. I throw that term out a lot, both with patients in the clinic and when I have a chance to make a presentation here at the workshop. And if you know me in my personal life, you know I'm joking around about brain-body communication. It's almost like, look, I'm not a one-trick pony, but I might be a one-conversation topic pony. But anyhow, brain-body communication means that our bodies are sending messages from the environment into our nervous system. The nerves are conveying the message to the spinal cord. The spinal cord is taking those messages to the brain, where the brain is assimilating and translating those messages and determining what they mean, and then sending messages back to the body in order to allow us to accommodate and allow us to maneuver ourselves in a way that's advantageous as a result of those particular stimuli and those particular messages that are coming in. For example, if you're out in a windy kind of day, you might say, that breeze feels pretty good. On the other hand, you might be out in the middle of a hurricane kind of day, and that wind could blow you 2 blocks down the road. We're talking about the same wind of 2 different intensities and 2 different levels of pressure and velocity. And your body is going to have to say to your brain, I perceive something here. It feels kind of like wind. What do you think, brain? And brain is going to make a determination and say, this is really a pleasant breeze. Let's go out for a walk. In other circumstances, the brain is going to have to say, this is way too much. This wind is incredible. I think we should go back into the basement shelter. And we go back into the basement shelter and survive to go for a walk another day. So this is the way the brain and the body are communicating with each other. So what we want to do, from my perspective, from a clinical chiropractic perspective, is what tools can we give the body to give most advantageous possibilities of having good, intact, accurate brain-body communication. So far, so good, everyone? So the 2 tools that I like to emphasize, re-emphasize, highlight, star in neon lettering are our posture and our ability to breathe. Essentially, your body is an antenna, and just all this environmental information is coming in all at once, and it's up to us to assimilate it and determine what's relevant, what's irrelevant, what are we going to do with it, how are we going to adapt to this information coming in. And we're going to receive the information accurately and efficiently. Our body should be as efficient as possible to be able to do that. And by employing good posture, that's reason number 1, mechanism number 1 to make that happen. So at the very beginning of this conversation, workshop, presentation, Dr. Tracy indicated that this is chiropractic rehab, workstation, posture, all combined, the sequel. On Tuesday morning, we talked about some of the very same concepts, but instead of talking about it in the context of let's get out of pain, let's talk about flowing through life comfortably, we talked about these same concepts applied to what if you had to design your own workstation? What if you were working at home? How would you go about doing it? So today we're essentially taking, certainly not the identical information, but very similar, and we're applying it to a different sector of life. So what I want everybody to do is just to think about your good posture. We want to make ourselves, first of all, tall or really long in the abdomen. So I have a hand here at my belt buckle, and I have a hand here right at the bottom of my pectoralis muscles, my pecs, right at there's a little tender piece of cartilage at what's called the xiphoid process, the bottom of the sternum. And I want to be as tall as possible as I can here. Now, if you noticed earlier in this presentation, as I'm talking, I'm kind of leaning into the desk in front of me. I'm swaying my body a little bit from side to side. I don't like to stand still. I keep my body engaged. I find a spot that I'm comfortable in. I hold it for 1 or 2 Mississippi. I move to another spot. And I'm going to explain to you why in just a moment. But let's talk about this posture. I'm long in this torso. So when I'm here leaning into the table and taking a step back and move over to my side and move to my other side, and I'm doing the Orbach shuffle, I'm still long here. If I'm sitting at my desk doing paperwork and I'm leaning over a clipboard in my lap, writing down notes, I'm still long in this position right here, creating good posture. I just noticed that somebody's putting up links to part 1 of this workshop, and I'm grateful for that. So chiropractors aren't celebrities. We're not going to be on postage stamps. It's just not going to happen. But I'm working on it. I'm working on it. And so the chance to see me lecture not once, but twice in a row, thank you. Anyway, all right, so we're long in our torso. What we're going to do with our shoulders is we're going to just throw them back. So if you could imagine my wing bones in my back, my shoulder blades, my scapula, they're sort of a triangular shaped bone with a point. They come to a pointy edge facing down and closer to the spine than closer to the lateral periphery. So I'm taking those points and I'm trying to touch my belt with them. It's not going to happen. I mean, I'm not going to be able to bend all the way backwards to the point where my shoulder blades touch my belt. But if I think about that as a visual, what happens? My shoulders are just thrown back into a comfortable position. And I'm literally just standing in a relaxed position here. And if you've watched people in military formation just stand for long periods of time, what are they doing? We got long in the torso, shoulders thrown back, and their bodies are just kind of locked into a spot where their bodies are supporting themselves. And like if I throw my weight out onto my left hip and I have almost go weightless on my right foot, or if I do the opposite and I go weightless on my right, I weight onto my right hip and weightless on my left foot, and I twist myself one way or the other, I'm essentially distorting my posture. And what I'm doing is I'm recruiting other muscles to hold myself as straight and upright and stable as possible. And I come out of my relaxed position and I start to develop muscle tension. I start to develop restrictions in joints. I start to do micro damage to the connective tissue, the ligaments and the tendons. And if you know me, you know that my face always itches. I can't help it. I don't know what the issue is. The tip of my nose is always itchy. And when I scratch it a little too often and I rip my microphone out or my earplugs out of my ears, I have a tendency to lose my thought and my connection for a second. So I'm sorry about that. But anyhow, we're going to be in this relaxed position rather than an asymmetrical, distorted position causing micro damage to body tissue, muscle spasms, joint restrictions, and adhesions. Instead, we're standing in the relaxed position. Now, what we're going to do with our heads is we're going to imagine that there's a string coming down from the ceiling attaching to the tallest point here. So I'm right in the top of my crown. And when you go to the doctor's office and they measure your height and you want to be as tall as possible and you're lifting your head up as high as you can so that arm on the scale comes out, I want the tallest point of my head hitting. That's the point we want to imagine floating up to the ceiling. So here I am with my head upright into the ceiling. My back is straight. My shoulders are back. I'm long in my torso, and I feel really comfortable. This is a good place to stand. If you're sitting at your desk, if you have a workstation, ideally, you're going to be at a standing desk doing exactly what I'm doing now. And if not, if you're sitting in a chair, whether it's the most ergonomically friendly chair designed for you specifically, or it's just a general office chair or a general folding chair, whatever you've got, if you're sitting in your chair, just go long in your torso, shoulders back, heads up. The chair no longer matters. You're using your body to support your body properly. All right, it looks like so far so good. So why is this so important? Well, now my muscle systems and my skeletal systems and the web of fascia, which is connective tissue that holds muscle to muscle, my tendons, which hold muscle to bone, the ligaments, which hold bone to bone, they are all as relaxed as they can possibly be. And if that happens, when that happens, now our bodies are be able to act as a very efficient antenna, picking up environmental stimulus all over the place, relaying it to my brain. Now, if I'm standing or sitting in this position and I turn my head side to side as far as I can possibly rotate to my left, as far as I can possibly rotate to my right. Now, I don't like to teach bad habits, but I like object lessons and I like show and feels. So if we kind of slouch a little bit and we turn our head all the way to the left and all the way to the right, you'll notice, I hope, that the better your posture, the straighter up you are, the better your range of motion. Okay, next important trick. We got to talk about breathing. We want to inhale through our nose and exhale through our mouths, and we want to use our diaphragms as a pump. So the diaphragm muscle lives approximately right here. We're at that same spot when we talked about going long in the abdomen and tall in the torso. The point at the top of the abdomen, the bottom of the chest, that's our diaphragm muscle. So we want to use it to contract and to expand, to help us pump air in and out of our bodies. So what we're going to do is we're going to inhale through our nose, and we're going to keep our shoulders in that down and back position. I'm going to inhale through my nose, and you're going to see how big my torso is going to get as I fill it up with delicious oxygen without shrugging my shoulders all the way up here. We're not doing this. We're doing right here, opening up, filling with air, hold it some more, and blow out through our mouths. All right, so what's significant about inhaling through our noses? Well, we have these very, very small, fine hair cells inside of our nasal cavities, which are going to act as filters. To a certain extent, are going to filter out some of the impurities in the oxygen that we are consuming. Air filter. Hold 1,001, 1,002. And now we're going to blow out through our mouths. And the air can just simply come out more forcefully, and we can expel it quicker through our mouths. So far, so good? All right. So we talk about how do our brain and our body communicate with one another? How is the brain actually sending messages out to the body? Well, we have our nervous system. We have all of these nerves that come off of the spinal cord comes off of the brain stem. The spinal cord throws off branches at every vertebral level. Those branches throw off branches, they're sub-branches, they're sub-sub-branches, and it looks like a giant web. And in part of that communication network, we can determine that messages from the brain out to the periphery, to the body, are going to have two different criteria. They're either they're going to be voluntary messages. So if I say, okay, everybody, it's time to stand up and do jumping jacks. You understand the language. You know what a jumping jack is. If you want to do it, go for it. Jump out of your chair and do some jumping jacks. If you don't want to, you're under no obligation. You can make the conscious decision to say, nope, no jumping jacks today, at least not now. I'm staying planted in my chair. So this is all voluntary brain-body communication. You have control of it. We also have non-voluntary brain-body communication. If I said to you, okay, everybody, let's all dilate our pupils. You guys understand the language. You know what a dilated pupil looks like. No matter how badly you want to, without some sort of external stimulus, you're not going to be able to. That's non-voluntary brain-body stuff. So the non-voluntary brain-body stuff would be classified as what's called the autonomic nervous system. Autonomic means non-voluntary nervous system. And then that autonomic nervous system can be subdivided into two categories. either the sympathetic nervous system or the parasympathetic nervous system. So time and a place for everything. Nothing is all good. Nothing is all bad. We got to have both sympathetic and parasympathetic. But most of the time, we would rather be in a parasympathetic state, which means wine and dine, rest and digest, be in a relaxed, calm, cool, collected state. Our sympathetic nervous system, now we're concerned with survival. This is fight or flight. We stepped out onto the porch and we felt that gentle breeze and thought, today is a great day for a walk. Our parasympathetic nervous system and our brain are in cahoots with one another because we want to feel good as that gentle breeze blows along in our faces as we go. We stepped off the porch and there's that hurricane-like event going on right before our eyes. This is survival mode. This is get back into the shelter as quickly as you possibly can or risk perishing. This is sympathetic nervous system. We need them both. But we don't want to be in that wound up sympathetic state where our heart's all day long. We don't want our blood pressure going through the roof in that sympathetic nervous system state. We want to be relaxed. So what we want to do is we want to give ourselves tools to come out of the sympathetic state and become more parasympathetic. Our cerebellum, which is one of the areas of the brain that helps us govern coordinated movement, balance. Our cerebellum has a secondary function, and that is that it fires to inhibit the sympathetic nervous system. So if we're driving our cerebellum, if we are doing voluntary activity and tasks and games and activities that will force our cerebellum into action and force us to use it, our cerebellum is going to fire. It's going to inhibit the sympathetic nervous system, and we're going to be able to become more parasympathetic dominant. So far, so good? Now, the sympathetic nervous system, the cerebellum, is the part of the brain most susceptible to oxygen deprivation. So if we're worn out and gasping for air or breathing shallow from using these muscles, are called the accessory muscles of respiration. If we're using the muscles in the front of our neck and the top of our chest to act as a pulley system to lift our rib cages up and hoist our diaphragm up there and get us to breathe kind of like we're panting and gasping for breath, we're not getting the job done. We want to breathe as deeply as possible, and all of that air that we're bringing in, all that oxygen that we're bringing in, is going to increase the likelihood and increase the probability that our cerebellum is going to get all the oxygen that it needs and then some, and there's going to be plenty left over for the rest of the body, and we're going to be able to use our cerebellum as a tool to inhibit or to depress the sympathetic nervous system, allowing ourselves to get into that wine and dine, rest and digest, well-relaxed parasympathetic state. So let's talk about one more time. Let's recap. Good posture, good breathing mechanics. What we're doing is we're able to use our bodies as an antenna without taking unnecessary or additional torquing or pulling on joints, compressing muscles, doing micro damage, micro tears to tendons and ligaments and the fascia, and we'll be able to best use our bodies as that antenna to bring information into the cerebellum. Good posture. We're able to put ourselves in a position to breathe deeply. Remember, when we turn our head all the way left, all the way right in good posture, our ranges of motion is so more vast versus that head forward can't turn all the way. Watch this. The same principle implies. I'd like everybody to indulge me here. We're going to be long in our torsos. Our shoulders are sunk back down. Our heads are up. And we're going to take that big, deep breath in through our nose. We're expanding our torso filling it up with delicious oxygen. Our diaphragms are engaged. We're going to use our diaphragm as a pump, and we're going to allow that air to now escape through our mouths. Now we're going to do that same thing, but this time we're going to have our head forward, and you're going to take that same deep breath in through your nose, and you're going to find that it just doesn't work. You're not able to ingest as much oxygen with your head in that poor head forward position. I'm going to take a brief, quick moment because I see a question popped up on the screen. Somebody asked, can hormone imbalance affect the cerebellum? Yes, absolutely. Hormone imbalances can literally affect any part of your body, any part of the nervous system. We have to look at our bodies as a single functioning unit, and we're trying to optimize that unit at all times. We're trying to employ all sorts of strategies that we can to make that unit function the way it's supposed to. And at the very beginning, I mentioned that certain nutritional deficiencies can lead to quite a bit of pain. Nutritional corrections can lead to pain reduction, maybe even pain elimination. And when we talk about imbalances in the cerebellum, I like that you use the term imbalance and not necessarily pain. I mean, an imbalance means that we're not governing the body the way it should, that we're suboptimal with an imbalance. And the hormonal system certainly has effects on the whole nervous system. And I believe that there are lectures throughout the week. I don't know what's happened yet or if it's later today, but people do speak about hormones in very specific detail. So we were talking about how does posture and breathing implicate the cerebellum and how the cerebellum will respond to accordingly to help suppress the sympathetic nervous system, to help coordinate the body. And I told you at the very beginning, one of my big reasons why would somebody come and see a chiropractor? Why would they want to be adjusted? And we talked about increasing your coordination, increasing your ability to be a little bit more athletic, feeling more comfortable in your body. Now, those are all central nervous, especially cerebellum related activities. So we also talked about pain. Pain being that individual emotional response to noxious stimuli. Pain is what brings people in to see a chiropractor. It's very, very rare that a patient will walk in to our office or really any chiropractor's office. I mean, it happens, but we don't have patients that walk in and say, I would like to be adjusted. I was reading in Men's Health magazine or whatever their literature of choice might be, how getting occasional chiropractic adjustments will optimize my body. Can you handle this for me? I'm sitting on the edge of my seat with bated breath, waiting for that day to come. So if you're out there, make my day and come in with that. But patients typically come in because they're in pain, they're in discomfort, their bodies are not feeling the way they've become accustomed to, and they don't want to become accustomed to this new pain state. So when we talk about pain, we're going to talk about how is the nervous system conveying information from the body to say there's been tissue damage or there's been a nutritional deficiency, or I'm so overly stressed and I've wrapped my mind around every possible worst case scenario and now I really hurt. Once again, I live in the physical world, and we talk about body tissue destruction, and we talk about how mobilizing and adjusting and stretching and releasing tension from muscles, how does that affect the brain, and how do we get out of pain this way? So my favorite story is the dental floss story. If I take a string of dental floss and I tie a knot in it and I put it between my bottom front teeth, and somebody else grasps the far edge of the dental floss and they pull in a direction that's disadvantageous for me, what's going to happen is the bottom part of my chin, my bottom jaw, is going to start to slide forward in response to the tension coming from the dental floss. I'm going to have a friction rub at my gum. It's going to bleed and it's going to hurt. And my real problems are going to be here at the hinge of my jaw, because as it's being pulled forward, these very small muscles, these guys are really, really strong when it comes to chewing, but they're not real strong to pull retraction, to pull my jaw back into its position. Now, they can do it, but it's not what they're designed for. So these very small muscles are going to tighten, and they're going to spasm, and they're going to become angry and inflamed, and it's going to impact the way I'm able to open and close my jaw. I'm going to lose range of motion when I chew. Chewing might even become painful. So far, so good. So if we're going to fix it, here's what we got to do. We got to repair the mechanics of the hinge of the jaw. Maybe that means a little coaxing it back and forth and manipulating it, and maybe even a little force to get it to move through its range of motion. We got to get rid of all of the inflammation that built up. That's, I'm partial to fish oil. I like turmeric. I like the X-Flame. Inflammation is a chemical process. We use chemistry, or we use nutrition to get rid of chemical problems. The third thing that has to happen, you got to quit pulling on the dental floss. Otherwise, we're going to do the same thing over and over again. Muscles, tendons, and the skeleton behave the same way. A muscle or a group of muscles or an action of muscles are going to spasm. They're going to pull in a direction that's disadvantageous for us. That's going to cause spasms, more spasms, and continued spasms. The muscles all attach to tendons, and the tendons are like the dental floss. They're a fixed length. No matter how hard you pull on the tendon, it's not going to stretch. It'll inflame, but it won't stretch. And then the other end of the tendon attaches to the point on the skeleton, and where two bones come together, we have a joint and we have movement. So whichever joint that muscle and that particular group of tendons act on are going to start to lose ranges of motion. They're going to start to inflame. We're going to have spasm, ratchety, painful movements. And just like we did with the dental floss story, we're going to quit pulling on the dental floss, meaning we're going to do some muscle therapy, some stretching, maybe even some meat tenderizing, and we're going to get tight muscles to relax and come out of spasm. Then we're going to make chiropractic adjustments to the joints to get them to move through their ranges of motion the way they're supposed to. Now, and of course, we're going to recommend the appropriate nutrition to reinforce all of the mechanical treatment to lubricate joints with hyaluronic acid, to relax tight muscles with magnesium and B vitamins, to get rid of inflammation with the turmeric, the X-Flame, the fish oil. The part of the story that I left out are the pressure-sensitive joint mechanoreceptors. In between every single joint in the body, whether we're talking about any of the bones of the spine neighboring with the one above or below, whether we're talking about the joints of the big toe or the elbow or the jaw, they all have common properties. And one of those properties is that they're richly populated with what are called mechanoreceptors. Mechanoreceptors respond to pressure, and the receptors are part of that antenna system that we've talked about in the body, where we want our antenna to receive and transmit proper information. So if the joint's not moving through its full range of motion, those receptors are going to fail. And when those receptors fail, we lose part of the criteria that makes up for a completely effective and efficient antenna. Accordingly, our brain is no longer going to receive all of that information that it's supposed to receive from that aspect of the antenna or from those particular joints. And the brain is going to go out looking for that information. And the brain is going to start to signal, hey, I got a light flashing. You got to respond. Get back on the walkie-talkie and tell me what's going on with you. And one of the principal signals that the brain starts to use are signals that the body is going to interpret as pain. So we're going to start to have pain messages traveling through our nervous system instead of feel-good messages. So the way nerves talk to one another is based on the diameter of the nerve. Two nerves of the same or similar diameter will have easy communication. Information comes from one nerve. The nerve synapses with the next nerve. The information jumps from over across the synapse to the next nerve, and then that information makes its way into the spinal cord and then the brain. So two nerves that would convey the same message would send a message along that nerve, and the message has no difficulty jumping from one synapse to the next. However, if a nerve is specifically designated to carry pain, it's going to have a specific diameter, and it's going to be called, in proper language, it's a C fiber. C as in Charlie. The sympathetic nervous system, the fight or flight nervous system that we talked about at the middle part of the conversation a few minutes ago, the sympathetic nervous system has its own type of fibers, own separate diameter. And the diameter of the sympathetic nervous system fibers and the diameter of the pain fibers is so close that they're able to fire together. And they form what's called an EFAPS, or an artificial synapse. So if we're in sympathetic overdrive, we're going to start forming EFAPSs throughout our bodies. Our bodies are going to start to interpret what's going on with our sympathetic activity, are wound up and tense and go into survival mode. They're going to interpret that as pain. So that's one more reason why we want to do good posture, good breathing, stimulate the cerebellum, get chiropractic adjustments to immobilize joints and make sure that those joint mechanoreceptors are firing and not dormant because they're living in stuck joints. And that's how we use chiropractic adjustments and muscle therapy to help patients come out of pain, to be able to live more comfortably in their bodies, to be able to move more freely, to be able to be more athletic. Now, I'm desperately running out of time, and I don't see any more questions on the board, so I'm going to throw something back else that was used to be on a different lecture that no longer exists. But I told you midway through the conversation, when I pulled the earpiece out of the computer and out of my ears and had to fix it up, how I like to move around a little bit, and I just shift my weight side to side, and I take that little box step forwards and backwards when I'm talking. I like to take up space. I like to take up physical space, and I like to occupy it. And I don't like to be small and confined. It's a subconscious mind hack. I did a whole lecture on subconscious mind hacks a few sales ago. Maybe in a future sale we'll do another one, but for right now, I'm going to talk about how would we use our subconscious mind to override our conscious mind and allow us to feel more assertive, allow us to feel like we're producing more endorphins, to generally feel better about ourselves, to feel more empowered. Well, one thing we can do is just take up more space. And that's why you don't see me standing still, and rather I'm shuffling and shifting from side to side, as I'm feeling more powerful by taking up the whole desk and not the small area that I would be confined to. The next subconscious mind trick, and this is what I'm going to leave you with before we wrap this all up, is along the same lines where I want to take up more space and feel more powerful. I'm literally going to bring my arms up over my head. I'm going to retain that same length in my abdomen. My shoulders are still back, so I'm not shrugging up and reaching for the ceiling. My arms are a little bit more out to the side, and my shoulder blades are still down and pointing towards my belt. My feet, you can't see them here with the way the camera is set up, but I'm standing in such a way that I'm substantially wider than shoulder width apart. So if you think about how many cubic feet does Orbach take up when he's in here versus all the way out here, I've just become a lot bigger. I'm not a hiker, I'm not a hunter, I'm not really a big outdoors person, but I've always heard that if you encounter a bear, you should be as loud as possible and start making yourself big and taking up space. And the bear should recognize you as a worthy foe, turn around and go the other direction. So what I want to challenge all of you to do is just take up more space. Stand here like so, with your arms a little bit up, a little bit out to the side, long in the abdomen, shoulders are sunk down, head still being pulled to the ceiling. And we're just going to take a couple, 3 deep breaths here in this position. In through your nose, everything is expanding, and blow out through your mouth. Again, big deep breath in through your nose. Everything is expanding, and out through your mouth. And if you do that and you feel a lot of fatigue in your shoulders and holding your arms up becomes heavy, the more you do it, the stronger you'll become, the easier it'll be for you. If you are feeling a pinching or a pain in your shoulders, or if you feel a tightness in your upper back or around your rib cage, when you take those couple deep breaths, you might have an issue that a good chiropractor can help you with. As I said at the very beginning, we're here in Green Tree next to two big highways in the Pittsburgh area, 376 and 79. We're easy to find. I'm here. Dr. Philip Ross is here. He can help you with your neuromusculoskeletal aches and pains. I want to thank you all for your kind attention, for indulging me, for spending this part of the morning workshopping with me. And since I don't see anything else on the screen, I guess that's a wrap.
Do you mind if I give them a quick tip?
All right, great
Phil,
job, Orbach.
Wait. Before we run off, this is Phil. He's our technology guru. He's a fantastic martial artist, all-around good guy, and he wants to address the crowd.
Yeah, so building on stuff that Dr. O said about making yourself big, it's really important for your workstation to be big as well. I spend a lot of my time at my desk here. I work the front desk. I go home and I study software and I sit at my desk for another 6 hours. So I have a lot of, what I found is it's really important to have, your desk space cleared, but also some small kind of like, I guess, a high-tech version instead is try to get yourself a big mouse pad and try to lower your mouse sensitivity on your computer. So when you're spending more time at your desk, you're moving your arm instead of sitting in a confined space and moving your wrist. It's more important it's for longevity, it's really nice to move your arm around and be more precise with your mouse than it is to sit there and be very tight with your muscles and end up, it hurts longer. In communities that I talk to, we all spend a lot of time on our computer, and the people who have a faster sensitivity on their computer and a smaller space to work with, they end up hurting their wrist more in a shorter period of time compared to the other one. So it's just something that I wanted to put out there.
Very nice. Thank you so much. Good job, Phil.
Tracy says good job, and I agree with her. See, this is a really important thing. I do more than the required amount of continuing ed every year, but my continuing ed is like, what does the doctor teaching feel like teaching today? And it's relevant to whatever it is they feel like teaching. It might not necessarily be relevant to what matters for real patients. So much of the feedback that I get I get feedback from one patient, and I'm passing that on to everybody else who's it's relevant for. And when Phil, who's maybe we're prone to a little hyperbole, but Phil is an awesome computer guy. And so when somebody like Phil, who spends so much time working at a desk, says, here's something I learned through experience, believe me, my antenna's going off. I'm sitting up straight and thinking, how am I going to be able to take this and add value to everybody else's day that I'm interacting with? So I really appreciate Phil throwing away any form of stage fright that he might have had and putting his face on camera and teaching us what he's learned through his experience. And I appreciate all other patients who drop tips here and there as well. This is a very important thing that practitioners can't lose sight of.
Amen. Thank you, Dr. Orbach.
Yeah, and thank you, Phil. And thank you, Tracy.
You're welcome. All right, guys, stay tuned. That was such a great lecture from Dr. Orbach. We are coming in live here next with Jamie and Joe. They're going to be reviewing some labels. They don't know what labels I picked. They don't know what products I picked, but they're going to be reviewing the labels and giving their expert analysis on the good, the bad, and the ugly of products that are out there on the market that may trick you into buying them. So we'll see you at 12 o'clock for our roundtable discussion.